Hello, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about sacral plexus and coccygeal nerves or coccygeal plexus. And we will start with plexus sacralis. Sacral plexus, it's a part of big lumbosacral plexus, plexus lumbosacralis. It's formed by a lesser part of lumbar fourth nerve, full lumbar fifth, then sacral first, sacral second, sacral third, and a lesser part of sacral fourth. Anterior branches of these spinal nerves unite and create your plexus sacralis. As you can see, plexus sacralis is situated in your pelvic cavity, and actually it's laying on your musculus piriformis. It's situated in front of your piriform muscle, and it gives a lot of branches, and you can divide them on long and short. Actually, we have only two, long and the main, and have a lot of short. So short one, they almost all motor and have name by the muscle that they are supply. So you will have their nervus piriformis that supply musculus piriformis. You will have nervus that come to your obturatorius internus muscle, so nervus obturatorius internus, nervus quadratus femoris. It's like very small short branches. We have few like relatively big nerves of short group of branches. It's nervus gluteus superior. Superior gluteal nerve, it's accompanied this arteria with the same name you remember in the veins, and it go out of your pelvic cavity through foramen suprapiriformis, you remember, also above piriform muscle, and supply these muscles that the same arteria do. So it innervates musculus gluteus medius, it innervates musculus gluteus minimus, and also its terminal branches reach musculus tensor fasciae lata. Then we have nervus gluteus inferior. It also accompanies arteria with the same name and veins. It come out of the pelvic cavity through foramen infrapiriformis, below piriform muscle, and its branches and divide musculus gluteus maximus, and that's all. And like the biggest nerve from this group of short nerves, it's nervus pudendus. Pudental nerve, it's also accompany arteria pudenda interna and veins. It's come out of your pelvic cavity through foramen infrapiriformis. Also, then you remember it's bend over spina sciatica and enters foramen ischiadicum minor. Then it's laying under the fascia of obturatorius internus in the canal with arteria and veins. It's laying in canalus pudendalis, and then enters your fossa ischiorectalis. It comes to your fossa ischiorectalis, and then it will divide. It divides on main motor branches that calls nervus rectalis inferior, that supply your musculus sphincter ani externus. It divides on a lot of nervi perinealis that supply all your muscles of your perineum. Terminal branches of nervus pudendalis will end at external genitalia. If we talk about female, it will be nervus dorsalis clitoridis and nervi labialis posterioris. If we talk about male, there will be nervus dorsalis penis and nervi scrotalis posterior that supply skin of your external genital. And that's all about nervus pudendus. There are only two. There are only two long nerves of your sacral plexus. It's nervus cutaneus femoris posterior. It's a posterior cutaneous nerve of thigh. And nervus sciaticus, the biggest nerve in your body, nervus sciatic nerve. So let's speak about nervus cutaneus femoris posterior. Nervus cutaneus femoris posterior, it also go through foramen infrapiriformis below your piriform muscle, and then it go down and like below marge of gluteus maximus muscles, pierce your fascia lata of your thigh and will divide. It gives a few groups of branches. First of all, it gives nervi cluneum inferiors, inferior cluneal nerves that supply this gluteal region. Next, it gives few rami perinealis, perineal branches, here they are, that come to you. It supplies skin of your perineal region, and it goes downward and terminates, divides on a lot of sensory branches, and supplies skin, as you can see, of your posterior aspect of your thigh until your fossa poplita. The most interesting and most important in this topic, it's of course, it's nervus sciaticus. Sciatic nerve also go out of your pelvic cavity through foramen infrapiriformis, below piriform muscle and on the level of superior angle of fossa poplita. It divides on nervus tibialis and nervus fibularis communis. So nervus sciaticus, while it go down, it gives muscle branches that supply muscles. So it gives branches to tortoris internus muscles, it gives branches to quadratus femoris, then it gives branches to all this posterior group of muscles. It supply musculus semitendinosus, supply musculus semimembranosus, supply only, pay attention, it supply only long head of musculus biceps femoris, and also it supply like posterior portion of adductor magnus, and that's all. It also can give branches to your hip joint, to articulatio coccygeal, and to knee joint, but in most cases knee joint is already supplied by tibialis nerve. So we can proceed with nervus tibialis. So nervus tibialis go down, it cross fossa poplita, and it gives branches to your knee joint, to these muscles, I will speak about it later, and enters canalis crura poplitus. You remember this canal, go through this canal, exit from medial marge of calcaneus tendon, then it go under the retinaculum flexorum, go under the malleolus medialis, and goes on the plantar side of your foot, and there will terminate it. It divides on two nerves, nervus plantaris medialis and nervus plantaris lateralis. So first of all, nervus tibialis gives a lot of muscle branches, motor branches that supply these muscles, mostly posterior group of muscles of your leg. And also it gives a few sensory branches. Well, first of all, I already told you it supply knee joint. Then it gives calcaneal branch, rams calcaneus, medialis that supply skin in the your calcaneal region. And I guess most interesting, before it enters your cruropopliteal canal, it gives first sensory branch that calls nervus cutaneus suramedialis. In popliteal fossa, before it goes to canalis cruropoplitus, it gives this cutaneous nerve of shin, nervus cutaneus suramedialis. As you can see, it's laying, it goes under your skin, it's laying between heads of gastrocnemius muscles. Go down in this groove, it accompany a vena saphenum parva. And goes down until like the middle of your leg, and there it will unite with another cutaneous nerve of your shin. It's nervus cutaneus surrelateralis. It's the branch of your nervus fibularis communis. It goes down and like on the middle, in the middle of your leg. They unite medial and lateral cutaneous nerves and create nervus suralis, sural nerve that goes down. And it also accompanies vena saphena parva, goes down from the leg on the foot. It go around your lateral malleolus and laying on lateral marge, lateral edge of your foot until your fifth toe. And supply, actually it's sensory nerves of skin, and it supply this like posterior aspect of your leg and lateral marge of your foot. And in this place, when this nervus suralis goes on your foot, it will have another name. It will have name nervus cutaneus dorsalis lateralis, dorsal lateral nerve of the foot. We come back to fossa poplita, the level where is sciatic nerve terminates, and divides on nervus tibialis and nervus fibularis communis. So common fibular nerve. As you can see, it declines to the lateral side. It goes to the lateral angle of your fossa poplita, and there gives this sensory branch nervus cutaneus sura lateralis. Also gives motor branch to your short head of biceps femoris, to caput breve musculus biceps femoris. Then it goes to the neck of your fibula, and there it divides on two nerves. It divides on deep and superficial fibular nerves, nervus fibularis profundus and nervus fibularis superficialis, or peroneal. You can also use this word nervus peroneus. So nervus peroneus superficialis, superficial one, it goes laterally and enters canal, canalis musculi peroneus superior, between fibula and peroneus longus muscle. It goes down in this lower part of your leg. It goes under the skin, divides on few sensory branches, supply skin, then it goes down and goes on your foot, and there it divides on two branches. While it's on the leg, this nerve, the superficial fibular nerve, supply these muscles that he laying on. It's musculus fibularis longus and musculus fibularis brevis, and skin, as you can see, and skin of lateral aspect of your shin. Then it divides on these branches that laying on your foot. So nervus cutaneus dorsalis medialis, as you can see, it divides on a few branches. First goes to your great toe, first toe, and supply like superior skin of superior aspect, dorsal aspect of your first toe, and another branch supply skin between your second and third fingers. Nervus cutaneus dorsalis intermedius supply skin between third and fourth fingers and between fourth and fifth. Deep. Nervus fibularis profundus. As you can see, it decline to the middle and laying on membrana interossea cruris and will accompany arteria tibialis anterior. It's laying between these muscles, go down, supply this muscle. So nervus fibularis profundus will supply anterior group of muscles of your leg. It's tibialis anterior muscle. It's extensor digitorum longus and extensor hallucis longus muscles. Goes under retinaculum extensorum superior and inferior. Laying on foot, on dorsal side of foot, gives motor branches to muscles of your dorsal side of foot. You remember there is extensor hallucis brevis and extensor digitorum brevis, and terminates with a small branch, with a small cutaneous branch that will supply small area between first and second toes. Then we come back on your foot, plantar side. On the foot, nervus tibialis divides on plantaris medialis and plantaris lateralis nerves. So nervus plantaris medialis goes to the middle and then divides on branches, deep and superficial. Deep branches, they are muscle branches and supply muscles this group muscles of your hallux and lumbricalis first and second muscles. Superficial branches became like nervi plantaris digitalis communis, then divides on proper nervi digitalis proprii plantaris and divides and supply, as you can see, all plantar surface of first, second, third, and medial aspect of fourth toes. Nervus plantaris lateralis. Lateral plantar nerve decline laterally into this groove in the sulcus plantaris lateralis with the same arteria, and also divides on superficial and deep branches. Deep branches, they are muscle branches and supply muscles of your digitus minimus, caput transversum, adductor hallucis. Also it divides this middle group of muscles of your foot, also lumbricalis fourth and third, and these interosseous muscles. Superficial branches, it also nervi plantaris digitalis communis, that divides on digitalis proprii plantaris, that supply plantar side of your fifth toe and lateral aspect of your fourth toe. But it's not all. These plantaris medialis and lateralis nerves supply skin not only on plantar side. It also supplies skin on dorsal side of your toes, only distal phalanx. So if you talk about plantaris medialis, it supplies distal phalanx of your first, second, third, and half of fourth toes. If you talk about plantaris lateralis, it supplies lateral side of fourth and all fifth toes, distal phalanx. We have left few more nerves. You remember I told about sacral plexus, and it's formed by, again, half of lumbar fourth, full lumbar 5, sacral first, second, third, and part of sacral fourth. But you remember that we have also sacral fifth and even coccygeal 1 or even 2 spinal nerves. Anterior branches of lesser part of sacral fourth, sacral fifth, and coccygeal 1 or 2, they also here can unite and create plexus coccygeus. These plexus coccygeus or coccygeal nerves, they lean on musculus levator ani, or even there is musculus coccygeus. And motor branches of these coccygeal nerves supply these muscles, supply levator ani and musculus coccygeus. And it also have few sensory branches, nervi anacoccygeae, that go down and supply this nervi anacoccygeae from coccygeal plexus and coccygeal nerves, will supply small area of skin between anus and the tip of coccyx. So if you speak about skin innervation of your lower limb, we start with your shin, and first of all, it's a medial aspect. It's your previous topic, you must remember it. It's nervus saphenous. There is infrapatellaris branch, there's nervus saphenous, it goes down with saphenum magna and supply your medial margin of your foot until your great toe. It's nervus saphenous. It's branch of your femoral nerve, it's plexus lumbalis. Then lateral aspect. Lateral aspect of your shin, it's supplied by, on this level, it's nervus cutaneus sura lateralis. It's branch of fibularis communis that go backward and will unite with the cutaneus sura medialis. And the inferior lateral aspect of your shin, your leg here, it's supplied by nervus fibularis superficialis, superficial fibular nerve that then goes on your foot and divides on medial and intermedius dorsal cutaneous nerves. If you talk about posterior aspect, here we go again. Medial, it's nervus, still nervus saphenous supply. Then posterior, like side skin between heads of your gastrocnemius, there is nervus cutaneus sura medialis. It's branch of your nervus tibialis side. It's supplied by nervus cutaneus sura lateralis. It's branch of fibularis communis. Then they unite and create nervus suralis. It goes down, supply these like inferior and lateral side of your skin, and then go around malleolus lateralis and will go on your foot. If you talk about plantar side of foot, it was supplied by different nerves. First of all, calcaneal region. From the medial side, it will supplied by calcaneal branches from nervus tibialis. Lateral side, it's applied by calcaneal branches from nervus suralis. Next, medial marge of your foot, it's applied by nervus saphenous. It's still saphenous nerve that goes till your toe. And also lateral marge, it's applied by terminal branch of your nervus suralis. It's nervus dorsalis lateralis. And we have plantar side. Plantar surface, it's applied by like the greater part of your plantar surface, it's applied by nervus plantaris medialis. Plantaris medialis, that's apply plantar side of first, second, third and half of fourth fingers. Lateral part, it's applied by nervus plantaris lateralis, it's all fifth and half of fourth toes. Dorsal side of foot, again we continue this saphenous medial marge, and we have three cutaneous dorsal nerves. First, it's terminal branch of your suralis. It's nervus cutaneus dorsalis lateralis. Nervus dorsalis medialis, that supply like upper part of your great toe and space between second and third finger. And cutaneus dorsalis intermedius, supply space between third and fourth and fifth. In this small area between second and first toes, it's supplied by deep fibular nerve, nervus fibularis profundus. And distal phalanx, dorsal surface of distal phalanx, first, second, third and half of fourth, it's supplied by plantaris medialis. Distal phalanx of your fifth and lateral aspect of fourth, it's plantaris lateralis. And it's all about skin innervation. If you talk about muscle innervation, it's very easy. It's very easy because posterior group of your thigh muscles is applied by nervus sciaticus. On your leg, you have three groups of muscles: posterior group, lateral group, and anterior group. And they have their own nerves. So posterior group of muscles of your leg is supplied by nervus tibialis. Lateral group of muscles, it's supplied by fibularis superficialis nerve, and anterior group, it's applied by nervus fibularis profundus. And muscles of foot, it's also easy. We have a few muscles on dorsal side of foot, and all they supplied by nervus fibularis profundus. And plantar muscles, like a group of muscles of your great toe, and lumbricalis first and second, it's supplied by plantaris medialis. All the rest muscles is supplied by plantaris lateralis. And now I guess that's all. So thank you for your attention. Subscribe to my channel, ask me some questions, and see you later. Peace.